fired up? Have you had your coffee? I want to thank Leonela Vega for that very warm introduction, and I also want to thank the Direct Care Alliance, which is just one of the most hard-working groups, and their efforts really have been tireless, and that is what has helped bring us here today. I want you to imagine for a moment a very tall corporate office building and a man working inside, sitting at his desk, dressed in a suit and tie. As my father would say, todo perfumado, so with cologne. And he's talking on the phone while he's working on his computer and drinking a cup of coffee, perhaps a latte even. Now I want you to imagine a small home in a quiet neighborhood, and a woman or man working inside wearing sneakers and comfortable clothes. And she or he is straining to lift up an elderly man almost twice their size, trying to help him put on a t-shirt so that he will be ready to eat lunch. I want you to ask yourselves, is the work that the corporate man doing more valued, more important than the work of the home worker? Is it better paid? I want you to think about that for a moment because I want you to know that all work in this country has dignity. And I'm here to say that our nation's law should respect the work that all of us do. Yet, even in America, some workers are paid less than minimum wage. Even in America, some workers are denied overtime pay. Even in America, some people don't have health insurance or other benefits, and their wages are so low that they need the assistance of food stamps to help make ends meet for their own families. Well, today I'm introducing legislation to show that in America, all work does have dignity. I'm introducing legislation that will say, regardless of the work you do, if you do well at it, and if you work hard at it, you should be compensated enough to take care of your family and to put food on the table. The legislation that I'm introducing today is meant to provide equity to those we trust enough to let into our homes and care for our loved ones. Home care workers are the linchpin of our nation's long-term health care system, providing essential care and daily living services to more than 13 million Americans. However, they are among the worst paying jobs in America, mostly because of Department of Labor regulations that exclude them from the federal minimum wage and overtime protections. In 1975, after Congress had revised the Fair Labor Standards Act to include previously excluded domestic service workers, the Department of Labor issued rules that exempted home care aides from the federal overtime and minimum wage protections that other workers got. The Clinton administration's Department of Labor issued proposed rules to try to correct this injustice, but the Bush administration withdrew those proposals. Today, Secretary of Labor Hilda Solis is tasked with the tough job of trying to fix 8 years of neglect and anti-worker policies of the Department of Labor, and she has committed to remedying this injustice by including it on her regulatory agenda, and I commend those efforts. But I believe that workers today not only need the right regulations, but they also need the right laws. I now want to make sure with this legislation that any administration, whether it's this administration or ones to come in the future, can never tell any worker that they are less than. The Direct Care Workforce Empowerment Act would do 3 important things. Number 1, it would ensure that home care workers receive the federal minimum wage and overtime protections of the Fair Labor Standards Act. Secondly, it would improve federal and state data collection and oversight with respect to the direct care workforce. And lastly, it will establish a grant program to help states improve direct care worker recruitment, retention, and training. Yesterday, someone asked me, why is this so important to you? Home care touches all of us. Most of us in this room know someone who has required the assistance of a home care worker at some point. They help their parents with my parents, probably your parents too, but they help their patients with daily living, enabling them to stay in their homes and maintain their independence instead of having to go to institutionalized care. I'm the daughter of someone who has Alzheimer's, and I know how important home care workers are. Yet every year, home care aides land on Forbes magazine's list of the 25 worst paying jobs in America. The mean annual wages for these workers put them behind parking lot attendants in terms of money earned. And once hired, unfortunately, there's a huge turnover, and many of them leave in droves. Turnover rates can be as high as 50 to 80% in a year. Bright rights that were earned decades ago by similar workers continue to be denied to these hard-working healthcare providers. Yet even healthcare reform signed into law this year failed to protect these workers, even though their jobs relate directly to quality of care. People with disabilities, seniors, and anyone needing home care on a permanent or temporary basis deserve to have caring, decently trained, and well-paid workers caring for them. Direct care workers constitute one of the largest and fastest growing workforces in the country, playing a vital role in job creation and economic growth, particularly in low-income communities. These workers help their clients bathe, dress, eat, take their medications regularly and on time, and negotiate a host of other daily tasks. They are a lifeline for those that they serve, as well as for families who are struggling to provide the care for a loved one when they simply can't do it. If labor conditions are not improved for these workers, the demand for more workers in the future may prove difficult to meet, and the quality of care may decline. Those who work in the industry will become less and less able to meet basic living expenses for themselves and their families, and they may move on to other work. Let's make things right for workers, no matter whether they sit behind a desk or care for someone in a home.